Hi, my name is Yamuna. Today I'm going to teach you all how to cover up your ankle by using this elastic bandage. As you guys know, there are multiple ways of bandaging skills, and as for today, we are going to see how to cover up your ankle by using this elastic bandage. Let's go!
Things to suffice. Generally, bandages are very helpful when we use it in a correct way and a method. The material commonly used in the roller bandage are cotton, wool, flannel, and a special material. The term that are used in the roller bandaging on the elbow is figure on 8. There's two types of roller bandage. The first one is the cotton bandage. Basically, the roller bandages will support the soft tissue injuries such as strain and sprain. And the second bandage is elastic bandage. Moving on to the techniques of the elbow bandaging. Select the appropriate bandage material for the elbow injury and the width of the bandage. Keep the joint partially flexed. Pass the bandage over and around the outside of the joint. Ensure the end of the tail of the bandage is fixed and the joint is covered. Pass the bandage from the inner side of the upper part of the limb below the joint. Continue bandage above and below the joint injury. Make 2 straight turns around the limb and secure the end of the bandage with the safety pin provided. Check the circulation for 10 minutes. That's all from me. Thank you, sir.
Greetings to you, sir. I'm Brinda Suranagam. The type of bandaging which I'll be presenting is shoulder bandaging. I'll be showing on how to do the shoulder compression wrap. A bandage is being used to keep a covering on an injury in position and to apply pressure to the affected region. Wrapping the shoulder in a tight bandage may aid healing by increasing blood flow, which allows important nutrients to reach damaged tissues and maintain cells' health during the healing process. Tightly wrapped bandages can help relieve pain and improve circulation, but they also run the risk of aggravating an injury that shouldn't be constricted. Shoulder injuries induced by repetitive stress, such as weightlifting, golf swings, volleyball serves, or moderate injuries sustained while playing sports or falling.
Now, I'll show you how to do the bandaging for the shoulder. Ascertain if the individual is at ease and inform them on what you will be doing. Do not lean across their body, work from the side of the injury. Use the proper bandage size because different areas of the body require different bandages widths. And for this, I'll be using the elastic bandage roll. Now, after knowing the injury position, you need to bandage the shoulder tightly. Make sure be careful. Start wrapping underneath the shoulder and bring it over the top. As you can see, I did it around 2 to 3 rounds. Step 3. Bring over bandage across the back, pulling it tightly and bring towards the unaffected arm and go across the chest. Remember that the bandage should be tight. As for the next and final step, ensure that the bandage roll has run out. Now take the stretch metal clips and clip it to the bandage to support the wrap. And we are done. This will help to relieve the stress and pain and also the pressure of strained muscles.
And that is how we do the shoulder compression wrap. That's all from me. Thank you.
A very good evening to Sir Izzuddin. I'm Kavisha Pandyan here. I would like to explain about the type of bandaging that I've chosen. I chose wrist bandaging. Usually a wrist sprain is a common injury for all sorts of athletes. All it takes is momentary loss of balance. As you sleep, you automatically stick your hand out to break your fall. But once your hand hits the ground, the force of impact bends it backward to forward your forearm. This can stretch the ligaments that connect the wrist and hand bones a little too far. The result is just tiny tears, or even worse, a complete break to the ligament. Other causes of wrist injuries are being hit the wrist and then exerting extreme pressure on the wrist or twisting it. The symptoms of wrist injury usually will be pain, swelling, bruising, weaknesses, and more. Wrist injury actually can be treated by compressing the wrist by bandage. Compression bandages are used to apply pressure to a specific area of our injury. They help to minimize swelling by keeping fluids from gathering at the injury site. Now I'm going to show a tutorial on how to perform the wrist bandaging. So this is the compression bandage. Okay, firstly, the individual can have their wrist in a neutral position. Starting above the side of the injury, just begin wrapping the entire wrist. Pull the bandage to your thumb side and wrap around your palm. Use the rest of the wrap to stabilize the wrist. Make sure that you don't wrap your wrist too tightly. If your fingers begin to tingle or go numb, you should remove the bandage and re-wrap. Wrap around your wrist. Once it's finished, secure it with a pin. Okay, done. That's all. Thank you.
Greetings to sir. My name is Nishanti Sandiran. Today I am going to demonstrate a bandaging skill on a body part. The body part that I have chose is forearm. As for our forearm, we can get a different type of injuries. For that, there are a lot of bandaging styles for our forearm, such as circular wrap, circular reverse wrap, figure 8 wrap, and a spiral wrap for different purposes. So today I am going to demonstrate how to do a spiral wrap. spiral wrap are usually used for our cylindrical body parts such as our forearm. A roller bandage can also be used to apply spiral bandaging to a tapered body part. Despite the increasing diameter of the body part, the elasticity will allow for the bandage to fit closely to the skin. And roller bandage can be applied to a limb to compress the blood vessels and help control bleeding. The bandage also provides support for the damaged muscle tissues. If there is an injury at forearm, you can place the iodine and cotton pad and use the spiral bandage technique to wrap it circularly to control the bleeding. Before the bandaging, firstly we need to prepare the patient for the bandaging. Then position the body part that need to be bandaged in a normal resting position, which is our forearm. Ensure that the body part that is to be bandaged is clean and dry. Do not wrap it too tightly. The roller bandage may act as a tourniquet on an injured limb, causing further damage. So now I'm going to demonstrate step by step how to do the spiral wrap.